Kettering General Hospital NHS Foundation Trust has opened its new treatment centre to provide the best healthcare for patients undergoing planned short-stay surgery and an integrated service for breast disease. The centre has been purpose-built to enable the hospital to perform 85% of its operations on a day case or short-stay basis. Designed in consultation with patients and staff, it is modern, clean and efficient, boasting an extremely high-quality patient-centred environment.
This is a wonderful unit. I think the staff are very friendly. We offer our patients excellent service.
It's absolutely clean. Very friendly atmosphere. You have a cafeteria on the ground floor with people who are waiting to be seen by doctors, feel much more relaxed, not rushed through.
It's a purpose-built unit, it's very modern, it's light, it's airy, we offer a very friendly and professional service.
Facilities at the treatment centre include quiet and comfortable pre-operative assessment rooms, where patients are carefully screened by dedicated pre-assessment nurses to confirm they are fit for surgery and anaesthetic, also ensuring that the patient fully understands the proposed operation and is ready to proceed. 4 operating theatres equipped to the highest standards, 3 of which are specifically designed for keyhole surgery. 10 single rooms and 3 spacious 3-bed bays for patients who need to stay in the unit for a maximum of 2 nights. A dedicated breast care unit that provides outpatient and breast imaging facilities, mammography and ultrasound. A light and airy reception area and cafe on the ground floor. The treatment centre only offers planned surgery, meaning that once scheduled, your appointment will have a reduced risk of being cancelled as a result of patients requiring emergency surgery. Wherever possible, your appointment time with us will be agreed in advance, and our aim is to have one of the shortest waiting times in the NHS. We are also committed to maintaining a high standard of cleanliness and infection control, with the majority of surgical patients being screened for MRSA in line with national guidelines.
Here at the treatment centre, infection control is one of our top priorities. We pride ourselves on the cleanliness of the building. We screen patients that are coming in for elective surgery for MRSA as per the national guidelines.
A number of operations at the treatment centre are performed using keyhole techniques. This means only small incisions are needed, allowing most patients to go home on the same day. An additional benefit is that this type of surgery heals quickly, enabling a more speedy recovery.
We offer the latest surgical techniques, both in respect of day surgery and in respect of short-stay surgery and diagnostics.
We tend to take things for granted nowadays because keyhole surgery is an everyday event. I'm afraid I've been around long enough to remember when a patient who came in for his meniscus to be taken out for a torn meniscus, they'd be in hospital for 5 days possibly.
From our point of view and from the patient's point of view, they have much shorter stays in hospital and much more shorter recovery times. So a member of the public who's working, say from gallbladder surgery, can be back at work after a month rather than having 3 months off work.
The treatment centre provides a protected environment. It is purely elective work, so you can plan the treatment and it can all be predictable. There's no worry about the beds being taken over by trauma cases coming in overnight, so if you've made a date for the patient, that date will happen.
Our team of highly experienced surgeons, anaesthetists and medical staff are specifically trained for these types of procedures. They are professional and friendly and will make your stay with us as pleasant as possible.
We treat patients individually for their care needs, looking at what it is that patient requires to make their patient journey as comfortable for that patient as possible. I think we value what the patient's concerns are.
They've been excellent since I first came in. Very good at explaining what's going to happen and what procedure we'll be following. Like I had to have an x-ray this morning and just make you feel very at home, very comfortable.
We believe all of this means that Kettering General Hospital's treatment centre should be your first choice for a planned operation or surgical procedure.
The staff were brilliant. They looked after me, popping in and out every 5 minutes to check I was okay. Very nice young lady come round frequently to make sure if I wanted tea or coffee or a drink.
The care has been absolutely first class. The nursing staff, The ladies that make the tea and coffee, the dinner, everything was first class.
It feels nice and airy and clean and new, and it's very positive. It's certainly very nice for a quick stay.
I had my own room, I had my own TV, I had en-suite facilities.
I feel very privileged to work within the treatment centre. It's a fantastic building, it's a lovely environment. The comments we get from patients are amazing.
I spend about 8 to 10 hours a day in the hospital. That environment has to be friendly and clean and welcoming. That's what it is.
Really, it's receiving up-to-date modern treatment, so it's 21st century medicine in a 21st century surrounding.